Right now.
It will be remembered how oxygen was supplied in hospitals when the COVID-19 pandemic struck, and still is the case in many other hospitals in the country. One oxygen cylinder for one patient at a time. This was the norm.
The Ministry of Health has confirmed the first coronavirus case in Kenya.
However, as COVID-19 cases rose by the hour, it was evident that oxygen was not enough for the patients. This called for a speedy solution to ensure that no more lives are lost due to lack of the important commodity.
Those hospitals with bed capacity, they have one car cylinder and one car floor humidifier unit, all right? They can use that cylinder and then they can give people more oxygen.
One of the solutions was to pipe oxygen directly to the patient's bed to enable easy and sufficient supply of oxygen at all times.
And in times when the oxygen demand is very high, then even though you have just, let's say, 4 patients, each patient requires their own oxygen cylinder. So if you have 3 full cylinders and one runs out, the patient whose cylinders run out is in trouble.
Another solution was installation of oxygen plants in hospitals, such that some could even give to other hospitals in other counties to save lives.
Of course, these things take a little bit of money, and based on those resources, then you're able to make improvements. I'm certain you're going to get there. But it shouldn't just be us. It has to be every facility, including public facilities. And where does that start? It means we prioritize these safety processes, we standardize what we are giving, and then we avail the resources to get that done.
Similarly, COVID-19 exposed a gap in the ICU facilities, especially lack of sufficient beds to accommodate the large number of patients.
There is this perception that now we have many ICU beds. We do not have nearly enough ICU beds in this country. In the Western countries, they have an ICU bed per department. The one for the mothers, obs-gyn, pediatric ICU, cardiac ICU, surgical ICU. And even the ICU beds we have are not nearly well equipped enough.
This saw many hospitals not only increase ICU beds, but also convert other wards to be ICU facilities to meet the needs of increased number of critical patients.
It's important to understand that an ICU is a system, not just the machines. And so a lot of people have seen buying a ventilator, buying a monitor, then having a room and calling that an ICU. That's extremely dangerous.
The main question that remains, however, is whether despite the changes in the sector, are there enough ICU doctors to cater for the needs of the ICU patients?
COVID-19 patient goes onto the ventilator. It's a very difficult case. So imagine someone who doesn't have anywhere close to my experience in ICU, then they start an ICU, and the first case they're dealing with is COVID-19. You can almost be guaranteed that that's 100% mortality. So this is something that should be built over time, not because of COVID, but because the country needs it.
All in all, there is an evident change for the better with regards to ICU capacity now compared to before COVID-19 hit the country. The onset of COVID-19 exposed a very important aspect in the health sector, that is oxygen, and the improvement of this particular area saw many hospitals pipe this important gas directly to beds to be able to save many lives any time that it is required. Robbie Omondi, K24, Nairobi.